You do everything you can. So here we were in western South Dakota, where it snows a lot. Our kids are grown and gone, thank God. I always thank God the kids were grown. And this terrible, truly, when this terrible section of our lives began to unfold, I'm glad they were raised. It didn't have to go through this with us. Because every year we would do the best we could to absorb the higher out-of-pocket costs and all the things that were going on with us, but the debt kept growing. First you borrow on the house, then you borrow on the cars. We knew good bankers at our local credit union, so they'd let us loan against our used cars. We'd take out loans and loans and loans. We'd call relatives and friends, to the point that when people would hear your voice on the other end of the phone, you'd hear their tone of voice change, because they were afraid you were calling to borrow money. Sometimes we were calling to borrow money. So it damaged personal relationships along the way. And then I started to have some problems, some symptoms that I knew were not very normal. And I was listening to Chris talk about the lady with breast cancer, and I'm just very lucky that I saw a professional when I did. I started to have some problems, and I talked to a nurse friend of mine and told her what was going on, and she said, "Oh man," she said, "I think you need to get to a doctor." But I knew we were about to change health insurance policies, so I waited and I waited. And I finally got to my nurse practitioner, who sent me on to get a DNC, and I was diagnosed with uterine cancer. And you know what my first thought was? It wasn't, "Oh my God, I might die." My first thought really was, "Oh my God, I might live. And I might cost us a whole hell of a lot of money on the way out. And I might die anyway. And I might leave Larry without the ability to keep himself alive. And if that's going to be the eventuality for me, I'd rather it just end quickly." So my entire thrust for a couple of months, and it sounds really crazy, but I think a lot of people in this country go through this, was to find out how serious this cancer was, not because I wanted it cured necessarily. I wanted to put forward a calendar for myself and a financial plan on when I needed to check out in order to leave Larry in good shape. So, in the meantime, I put this in because this is all unfolding at the same time, but I was still working full-time, and Larry was still working full-time, believe it or not, when he had this surgery. This actually shows Larry had run out of good vessels to use in his legs. You know how most people, when they have heart bypass, they take them out of their legs? Well, he's run out of good vessels in his legs, so they took his artery out of his arm this time. And that's the bruising that results when you do that kind of thing in somebody's arm. And I was working late and trying to write articles late at night and trying to recover from my own cancer. I'd had surgery and a round of chemo and a round of radiation. We were hopeful that I was doing pretty well, but I was back to work too soon. I ended up developing a huge abdominal hernia, for which I had to go back in and have a prosthetic mesh put in my belly because I went back to work too fast. Another offshoot of another costly thing we do in this system is people go to work right away, because guess what I was afraid of? If I don't go to work, I can't keep our insurance. I can't keep our health care coverage going. So it was like this middle-class work ethic run amok, this terrible fear that I couldn't keep him alive, I couldn't keep myself alive, and I didn't really want to let everybody know how bad things were. Well, a friend of mine called from college, and she asked me if I knew Michael Moore was working on a movie about health care, and to be honest, I kind of was not very nice to her. I said, "Oh my God. Come on. So what? What would that have to do with me?" You know, Michael Moore wants to tell stories about downtrodden people who have nothing and no insurance. They don't want to tell people, I really thought myself a loser. I thought about losers like me who can't find a way to pull this together. I really felt like I just wasn't smart enough to find a way to get through this. I was very ashamed. Ashamed of the bill collectors calling. What happens at 8 o'clock every night? Do all of you know? The collectors can't call anymore by law. So after 8 o'clock at night, I could turn the ringer back on our telephone. It was safe to be in my own home after 8 o'clock at night. It's just this constant reminder that you have failed in this system. So enters this guy. This is Michael Moore. the first day I met him in Miami. I look pretty silly because I was pretty excited about meeting him, actually. And how many of you have heard disparaging things about Michael Moore's ability to tell the truth? Come on. Me too. Everybody, yeah, right? Me too. And my husband was very, very leery. Very leery. But I was one of the 25,000 email messages they received on their website, which always still astounds me that my message was one, because it was kind of nasty. It actually said, well, you're doing this great movie about healthcare. Why don't you spend a few minutes talking about the insured people in this country who are going under? I never thought I'd hear from them. And I got a letter from a producer, and we ended up having to provide all of our credit documents, our credit reports, all of our bills, all of our medical records. We had to give his legal department access to everything, because they cannot afford to tell a story that's not true, because he's such a target for that kind of accusation. And we still didn't know if he was going to tell our story, and didn't know if it mattered, to be very honest. I didn't know what it could mean to me. Why would I care? Why would I want to do it? Would it help us in any way? Would it help the country in any way? Or would it just be stupid in an exercise in some kind of self-aggrandizement on a movie screen? But when I called them eventually and told them that we were going under and that we were going to have to move in with our daughter, and that's what resulted in our scenes in the movie. They called and said, can we follow you? Can we send the cameras with you? And I said, yeah, I don't care. So that's what started our journey with Michael Moore, is them sending cameras to South Dakota. I remember I sent a message to Tom Daschle, because I was fairly close to him by this time. I had challenged him in some town hall meetings about, I don't understand why you're all having brain death about health care in Washington. I don't get it. I don't get it. We want the security that you have. We don't want necessarily your insurance plan, but we want the security that you have. We give it to you. We pay for it for you. And yet you all pretend you don't get it? I don't understand that. And to Tom Daschle's credit, he went back to Washington even in 2004, spoke about Larry and I on the Senate floor, and wrote a sense of the Senate resolution saying that every American ought to have access to the same level of health care as every member of Congress. That was in 2004 that he did that. Now, 20 other senators, including Senator Kennedy, signed on to that statement with him, but you see how long we took us to get what we got this time around. And Tom Daschle, obviously, we know what happened with him. John Thune beat him in the election in South Dakota the next time around. And South Dakota citizens, that was dumb of them, really. You put out one of the leaders of the U.S. Senate and elect John Thune. But anyway, then he was to be, as you know, he had been preferred by President Obama as our new Secretary of Health and Human Services. But because he had an old tax problem, he could not be considered for that position. Although I also tell people, mind you, I love him, so I'm very biased. But I feel like a man with that kind of wealth, he would far rather have paid that money. You know, he's one of those folks, like a lot of rich people, I don't understand it because I've never been in this position, who hand off handling their finances to other folks. They really don't think about it too much, and I tend to believe that that's the situation that unfolded. But in any case, I sent Tom a message after Michael Moore said he wanted to film us, and I said, here's the story, Tom. Michael Moore wants to tell Larry and I's story. But if I do that, I don't think I'm going to be able to be the editor of the Black Hills Pioneer anymore, because it's pretty conservative stuff. And I still have his message too. He sent a message back to me that said, I think you should do it and move. He was very